Hello, welcome everybody to our webinar today. We're excited to have us join you. This is Paul Yoakum. I'll be your event host and moderator today. And want to welcome you in. We've got a diverse group from literally all over the globe. So good morning if you're joining us here on the West Coast. Good afternoon if you're on the East Coast, or perhaps even good evening if you're outside the United States. So we thank you for taking time out of your busy schedules to join us today. And we're excited to provide you with some great insights into some of the things that we've learned, and hopefully can help you in your current jobs as caregivers and healthcare practitioners. Just by way of housekeeping, we are recording today's session, and we'll send you the link a link to the recording following the session, so you can either watch it again or share it with those who weren't able to attend. We'll go for about 30 minutes here and cover a ton of information, so buckle up and get ready to go. With that, I'm going to go ahead and get us started here and introduce our speaker and presenter today. We're very excited to have Dr. Jean Greaves from TalentSmart present to us. She's the co-founder and CEO of TalentSmart, as well as a best-selling author of the book Emotional Intelligence 2.0. Jean's got more than 20 years experience in this space, has multiple degrees, is a PhD in psychology, and has run executive sessions and done leadership coaching and you name it with organizations of all sizes all over the world. So we're really excited to have Jean join us today and share some insights that I think you'll find kind of eye-opening and practical. So Jean, with that, are you there? Can you hear us?
Yeah.
And are you ready to go?
I am ready. Hi to you, Paul, and hello to each and every one of you who carved out a little bit of time to spend with me today. I appreciate this conversation that we'll have, and hopefully that it will be useful to you. I have given Paul permission to chime in with a couple of questions here and there, so he's welcome to check in on a couple of points on my behalf and as well as on behalf of all of you. But I wanted to kind of just get started with the context of this topic of HCAHPS. This particular slide, I promise, has the most information on it. You can glance at the factoids here just to remind yourself some specifics about this survey data. But I wanted to provide you sort of a bigger context for it and talk about what this measure really is. This measure, from our perspective, is perception data. Right? So perception data offers a window into how people feel. These questions are answered on the part of patients either 2 days, somewhere in the time frame of 2 days to 6 weeks after being in the hospital. And the answers reflect how they felt about their patient care team, as well as how they felt about the room they stayed in and the level of comfort they felt while they were there. So imagine this, 5 of 6 members of that team could be courteous, respectful, great listeners, communicators, but if 1 or 2 members of the team have a really bad day or one really awkward interaction with the patient or their family, that memory can linger and influence that patient's overall feeling, and suddenly it shows up in the responses on their surveys. So suddenly you can begin to see why emotions and feelings are very relevant to the discussion of measuring the outcomes of the overall patient experience. You'll see here that 18 of the 32 questions are on a scale of about, how often they felt about specifics. So I thought maybe we could start there and get a little more specific.
Yeah, Jean, let me just jump in there. I'm just curious. I would imagine most of the folks on the call probably know this already, but just for those of us who don't, what exactly is on this survey that we're talking about here, and what does it have to do with emotions, as it relates to the emotions of healthcare professionals? Can you maybe just
Sure.
walk us through that a little bit?
Yeah, of course. Okay. So the overall topics are courtesy, respect, clear communication, and this is on a frequency scale. So patients respond with how often their room was kept clean or quiet, or their call button was responded to quickly, or the pain was managed to their own comfort level. these are the 18 questions I'm referring to. The other kinds of questions on the assessment have to do with demographics and what kind of hospital stay they had. Now, a couple of examples here include the following, right? So during this hospital stay, how often did your nurses listen carefully to you? Or how often did the doctors listen carefully to you? So again, if I can have you picture this, right? A hospital stay over 2 to 3 nights or a week, you know, each patient is interacting with multiple nurses across shifts. And every member of that provider care team brings various moods and feelings into their workday, right? So they have periods of clarity and concentration. They're being responsive, they're diagnosing, they're noticing, but they also have moments where they feel distracted or stressed or worn out or hungry, just like any of us. We are all humans at work, and we bring in our sort of life stressors, and we navigate those moods better and worse throughout our day. And all these feelings surface while patients are observing them and feeling them and remembering whether they felt listened to carefully when answering the questions on the HCAHPS survey later. Yeah, so what's interesting about this is I should probably catch us up and define, you know, this concept of emotional intelligence. So as we dive into the connection between emotions and HCAHPS survey data, we're all sort of understanding this similarly. So we define emotional intelligence as your ability to recognize and understand your emotions. This is as they surface. You're noticing them and understanding where they come from, as well as your skill at using this awareness to manage yourself and your relationships with others. And by manage, what we really mean is what you're saying and doing in the moment, right? Or what you're choosing not to say and not to do in the moment if it's going to make matters worse. So behaviors can mean either acts of commission or acts of omission, right? Now, I also want to differentiate EQ from these other very common topics of IQ and personality, because we do get asked this quite a bit. IQ is your ability to learn, and your personality is who you are, both very stable traits in a care provider. They don't change dramatically from day to day at work, right? A person's EQ is more of a skill set, right? It's their personal and social competence skills. So my view is that EQ is the skills we use to make the most of who we are, our personality styles, and what we know on the job, which is essentially the culmination of our smarts, right? It's all that we know is our ability to learn. We've gotten through school, now we've gotten hired, and we are on the job bringing all of that to the table.
Jean, let me just jump in there. I love this slide. It really shows us kind of a nice picture of how we kind of become well-rounded here. Can you give us a nugget about what you think is most important for healthcare professionals to understand when it comes to managing their emotions at work? I think we're going to dive deeper into that EQ bucket right now, but I want to just kind of plant that so you can get your thoughts on that as we go forward.
Yeah, I'm actually really happy to share one of the most important findings that's come out of the field of EQ research. And let me just show you right here what it is, right? So emotional intelligence surfaced in the mid-90s. We're only 20 years in, so it's a fairly new field when you think about how long it takes to really see iterative findings that get supported over and over. But with 20 years, we're able to take a look at articles. We stay in touch with the latest findings in academic research. And one of those that's repeated over and over is how contagious emotions are, both in the workplace and out in the world as you move through your day. So now add to that a person in a position of authority, right? So, you know, a physician in a lab coat or a nurse practitioner walking into the room, all of those outfits in a hospital do communicate positions of expertise and authority. So when nurses walk into a patient's room, their moods are experienced by the family members and the patients at a much stronger level than, say, a peer-to-peer or colleague-to-colleague exchange. This begins to suggest and paint a picture for why healthcare professionals need to be accountable for how they are communicating what they're thinking and feeling, right? You might imagine that all of these years of preparation, you have one more layer of subtlety that now you're responsible for for all 8 hours and 10-hour and 12-hour shifts? And the honest answer is yes. You know, organizations have the right and wherewithal to ask their workforce to become aware and to manage those interactions productively. So when I think about it, I think, well, yes, we're all worried about the superbugs and germs that might exist in hospitals, but in human interactions, we also have to consider how we're sharing and spreading our moods around. And patients are picking those up and feeling it and absorbing it. But here's the good news. I've defined emotional intelligence as a set of skills, which means that you are not born with a high EQ or a low EQ, right? It can be developed, and various parts of emotional intelligence can be developed within months. So if someone in their early 20s is already showing up as, you know, very socially aware and able to, you know, tune in on what's really going on when a patient isn't really as talkative on a particular day, right? But they may not be so good at other things. Say, for example, conflict with a coworker, or conflict with a family member who's really starting to become a pest, right? That's where a skill set comes into play. And the way you develop it involves forming, you know, really good habits through repeated practice. That's the secret to it all. It's not difficult, but you have to commit and tend to it over and over. Now, let me take this knowledge about EQ and carry us through to building the patient experience. So when we think about the connection between a care provider's EQ skills and making patients feel cared for while providing their medical experience, here's how this is happening. We consider EQ to be sort of the foundation, right? It is what's helping boost the competencies that matter to healthcare organizations. So you'll see in the leaves on this tree, right, these are the kinds of competency lists you'll see in a leadership competency model of a healthcare system. TalentSmart doesn't believe that we should be replacing those with EQ. EQ certainly is as important, and we believe it has a place at the table, but more importantly, when you invest in helping people become more self-aware, you're going to find they're able to notice when they're feeling stressed and self-manage to choose to do something about it, right? Whether it is like, I really have to go eat something, or I've just got to sit down for 60 seconds and catch my breath here. So we consider it to be sort of what drives the ability for people to see results in how they show up with their patients. Now you sort of begin to see this full circle: courtesy, respect, cleanliness, comfort. When any of the patient care team members are walking into a room, they're responsible for all that they are, right? Looking at charts, asking questions, making sure the patients are eating what they need to be, but they may look over and notice, gosh, you know, that this room is looking, you know, a little messy. There were a bunch of visitors. They brought a bunch of In-N-Out burger. They've left all of this. Maybe I'll just have someone come in and spruce this up. Or they may notice that their patient fell asleep with the TV on, and maybe that noise isn't going to allow them to sleep as restfully as they could. It's taking those extra little moments to notice things and contribute to the overall experience of the patient, right? Now, when you add to it the challenge of a difficult day, right? You're worried about being able to get home on time, or other kinds of responsibilities that you have outside of work. You're worried about some type of an evening exam that you're going to take, and that particular patient comes from a culture that you truly have never encountered before. You don't quite understand. Maybe you're a person that interacts quite differently with young people versus the senior member of a particular family. All of these things sort of add layers of complexity, and the patient care provider has to be able to, you know, make the appropriate contact. You know, that includes eye contact. You know, they may be looking at the charts and gathering information, but if you don't remember to look up and smile and reassure that patient is looking for, should I feel worried about myself? You know, am I worse? Am I better? Same with family members. So this begins to sort of explain why this is complex in nature, and that all of healthcare providers need some investment and support on how to develop these skills. So here, if I bring this right back to how we look at this more specifically, at TalentSmart, we think about these scenarios, right, as we work with healthcare professionals, both in our training sessions and our one-on-one coaching efforts. So here I've shared a few examples of how the strategies in Emotional Intelligence 2.0 can help a doctor or a nurse on that hectic week when it's not as easy to show up as their best self, right, with a difficult patient. You know, I'll give you an example of one I was very familiar with and involved with. We worked with a group of physicians throughout a whole day, sort of touring through each of these core competencies and identifying what their challenges were and what they could do about it more specifically. And one of their challenges that they shared was that they're always thinking about the next thing, right? There are other patients, the labs they have to review, a meeting that's coming up, et cetera, et cetera. So after going through a process that we've designed for sessions like this, these physicians committed for the next several weeks and months, what they were going to do is they were all going to walk up to whatever room that they needed to enter and just stop outside the patient door to simply breathe in deeply once for a good 1 to 3 seconds and clear away the clutter in their mind before walking in the patient's room. Even if the patient's room is wide open and had no door, right, the idea would be to just stop at the threshold and clear away the clutter in your mind by breathing deeply. You can quickly picture that the patient has a better chance of feeling that their doctor was present and listening carefully. And we've mapped our 66 strategies in the book to all 18 questions in the HCAHPS survey, right? So on this particular slide, I'm just showing you a sprinkling of a few. It doesn't mean that self-awareness is the only set of strategies that would help nurses and doctors treat a patient with courtesy and respect. But here are 2 self-awareness strategies that could help with that. There are more for self-management and social awareness as well. These are specifics, and I would say the power in an assessment and the power in a training, the real boost in coaching is getting down to those small behaviors in very specific situations. That's the material where you make behavior change, right? Specific situations.
Jean, let me just jump in right there. This is great. I totally get this. I love what you're saying here. We've had a few questions, and I'm curious to know. You mentioned recently the assessment, and I know TalentSmart has had millions of people take the assessment. But have you looked at those in healthcare specifically who have assessed their EQ skills? What does that look like compared to the regular population?
Okay, sure. Yes. We do have multiple types of assessments. They're all the same number of items. It's the emotional intelligence appraisal. And across all the versions that we have about, picture this, about 28 different databases. These would be different language versions as well as self-assessment, 360s, true multi-raters. And across the self-assessments, the average normative score is 75. So across the millions of people who have been taking this since 2002, we easily have in any one database about 2,000 people taking this assessment every single week. It's quite dynamic, so that's why I'm not giving you a really specific number. It'll be different tomorrow as it was yesterday. But across that whole population, on average, people are getting scores of 75. When we carve out healthcare professionals, their overall scores are slightly higher, right, with the highest in social awareness. But differences of 76 and 75 and 75 compared to 77, those aren't dramatic differences. But it's not surprising to me when you get such large normative sample sizes. What becomes more important and more interesting is when you begin to kind of identify what does this mean for an organization and what can they do with the overall average. And one of the reasons why this average is in the 70s and not, say, in the 80s is that when we think about emotional intelligence as a competency set, people did not come through their schooling system being expected to really work on it. So you have some people who had great role models and are naturally emulating high emotional intelligence behaviors, and those who are not. So you have some higher and some lower. So overall, it's not yet a strength. So for those organizations that begin to support their staff to practice this skill set, they begin to have a shot at having a competitive advantage in the marketplace. When a higher percentage of your workforce is moving into strengths to build on or strengths to capitalize on, you're now beginning to propagate in your organization basically a team of mentors to other people who can begin to help strategize and help younger and older people who really need sort of good ideas for how to practice and improve on an ongoing basis. Now, would someone's EQ improve with life experience? Likely. So I want to share one other story that I think is really relevant to all of this. And that is when we track people who take the assessment and then they go back and take it again after an intervention of being able to practice and improve with the support of training or coaching or mentoring, what we find overall is that the kind of increase that they achieve is 7 points. That's the average boost from test, retest scores for organizations that are actively developing their workforce EQ. Now, what would it be if you did nothing? It's not nothing. You wouldn't be 75 your entire career. When we find what the average EQ score of people in their 20s versus people in their 30s, 40s, 50s, if you take each of those cohorts, on average EQ goes up about 3 points with every decade of life, right? Now, when you think about that, that begins to mean that when an organization gets you rolling and asks you working on your EQ, that group of employees has a shot at getting farther faster, right? They almost get 20 years of improvement within a period of a year, right? So yeah, they might be 7 points higher when they're in their 40s and 50s, but they could get there much sooner with the help of awareness and strategies and practice. And then I get the question, you know, how long does it take, right? And overall, we find marked improvement in very specific behaviors within the 6 to 9 month time frame. Now, that doesn't mean you're going to get higher scores in every one of the 4 core skills. You might find that there's 3 very specific bad habits that you want to work on. Like maybe you're someone who interrupts people, or you're someone who forgets to notice when you're stressed out, and you're basically spreading your stress all over the hallways on those kinds of days. So those are the kinds of improvements you're going to see in 9 months. So it's kind of a lifelong journey, and you're in an iterative process, identifying the next bad habit to polish and improve, and away you go.
So speaking of interrupting, Jean, let me just jump in with the question.
Please do.
Over that 9 month period between test and retest, is it better to work on your EQ skills privately, just kind of reflecting on what that looks like? Is it better with a coach? Is it better to go through training and actually train for it? Is there a combination? What do you kind of recommend? Is it if it's a skill, the best way to go about building that skill, I guess, is the ultimate question.
Right. Okay. So yeah, these are the kind of choices that leadership development departments, human resources departments, even department managers are having to kind of sort out on a yearly basis. So I'll share with you what I know from the work of our healthcare clients and what we know from adult learning research. And probably the easiest way to remember it comes from, that advice we all get in our financial investment world, which is diversify, 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 right? So let me share the 2 kernels, and that is you need repeated practice to create new neural connections in your brain. That is really the fiber of developing and increasing emotional intelligence. You're replacing an old habit by neglect, letting it go away, and you're inserting a new habit and strengthening that neural connection. So it's repeated practice. But it's not necessarily repeated practice in only one way. You need repeated practice across situations, across people, and across time. So this little image here, I'm essentially sharing with you one example of an ideal approach. And then there are probably about 6 different versions of this type of design. So there's quite a bit of flexibility, but it starts with priming people's minds. And the best way to learn about your EQ is to make it personal, right? Learn about your EQ. So that's why we like to build in some version of an assessment. And asking people to read about a topic before they find out their results, that's certainly appropriate, right? I am a believer in group learning because that's the place where you can experience laughter, you can experience stories. There's something about the human brain that really responds to it. It creates the conditions of insights and ahas that linger in your memory, and it creates this feeling of feeling motivated to get out there because you're not alone in venturing forward to practice. You know a bunch of your coworkers are going to be doing the same thing. So things like action plans and giving them strategies, asking them to be held accountable by going and talking to a mentor inside the organization or sharing at a team meeting what they learned from a session, these are all appropriate. Many of our healthcare clients are beginning to add coaching after a session to allow a confidential space for people to process the results of what they learned, if they got feedback from their clients or even their coworkers in some type of a multi-rater assessment. We like to spread coaching out over a period of time. You'll see 30 days, 60 days, 90 days. Even in the 90-day version, some organizations really align back to the day-to-day priorities of their organization by making sure there's a session with the person that each person reports to, right? So they can share what they learned and then discuss how they're going to support one another going forward. But people do need time for that independent practice, so you should be giving it to them and certainly mark progress by allowing them to reassess and find out how much better they're getting at those targeted behaviors that they promised that they would connect to, right? But I know that there's one other thing I wanted to add. One is for organizations and the other is for each individual. So my last sort of contribution to this conversation really is, what would I advise anyone? It would be to seek self-awareness and commit to these small, specific, targeted improvements. Identify it and practice it for 3 weeks to 3 months. And give yourself permission to practice at home, practice with your kids, practice in committee work across situations, and people will really help you improve your emotional intelligence. And I do wish you the best as you venture forward, because it's a career-long journey. It's a career-long journey here at TalentSmart, and we invite you in and join this process that I think will help the organization, help you in your work, and help results on HCAHPS survey data responses. So Paul, I'll mention to you that if there are questions, you can certainly ask me any final ones, but I'll leave this with you to kind of wrap up for everyone. I know they have busy days and they need to move on.
Yeah, no, appreciate it, Jean. If there are any questions, we will do our best to answer those. We are coming up to the end here, so I'll just kind of give a final thought to wrap up. For me, I've always had the utmost respect for healthcare practitioners and the job that they do, and oftentimes delivering bad news or dealing with unruly patients. I can't even begin to tell you, how much respect I have for the nurses that had to deal with my dad when he was sick. Those poor people, and They did it with such love and such care. And it wasn't until I joined TalentSmart that I really understood how important emotional intelligence is, and being able to be not only self-aware but socially aware, and to leverage those skills. And my takeaway here was that the healthcare practitioners are a little bit above the normal, but there is still room for improvement, and this can really go a long way to improving that patient experience, which then improves HCAHPS scores, and it all starts with the employee experience. So just a final thought here, as you're looking on the screen, there's a couple of things you might be thinking, well, how do I learn more? Where do I get started? We've got something for everybody, essentially. If you want to start with yourself, take the assessment, right? If your organization is developing this as part of a leadership curriculum, we have both on-site training programs as well as a trainer certification program. if you want Jean to come coach you, she's more than happy to do that as well. So really, we've just tried to make it as easy as possible and as flexible as possible to to help meet whatever needs that you have. And again, we're going to send out a follow-up email. You'll hear from us shortly with the link to the recording, as well as some other assets and resources that tie to what we've talked about today, and take a little bit more deeper look at the research. So with that, I want to just thank you, Jean. Appreciate everybody joining us today. We've made it through 30 minutes, and there's been a lot of information, I know. So watch the recording again. Capture those ahas that jumped out at you, and then let us know how we can help. And so with that, we're going to go ahead and conclude our broadcast today, but wish you the best as you develop your emotional intelligence skills and become a better healthcare practitioner. So thanks, everybody. Catch you soon.